6-year follow-up of Trial of Antenatal vitamin for asthma reduction. Definition: Vitamin D, a steroid vitamin which promotes the intestinal absorption and metabolism of calcium and phosphorus. Under normal conditions of sunlight exposure, no dietary supplementation is necessary because sunlight promotes adequate vitamin D synthesis in the skin.
Vitamin D supplements are very controversial these days. For some years now, there's been a large promotion of vitamin D supplements, often by the nutrition industry and by non-medical personnel. There's been some recent studies that suggest that vitamin D might lower blood pressure, but these studies are not of the highest quality. There's also controversy because national authorities are not certain what level of vitamin D actually is a normal level and what constitutes a low level. Our advice is not to start vitamin D as a means to lower blood pressure. There's really not enough evidence to suggest that that's a beneficial approach. Again, caution is indicated. Not taking vitamin D unless there's a very clear indication is probably the right policy, with one exception. Calcium and vitamin D in women, particularly women at risk for osteoporosis, does have benefits. For the male gender, there's less evidence of benefit. There's uncertainty about what a normal level is. It's certainly not in prime time approach to lowering blood pressure and shouldn't be relied upon as a means to control blood pressure for those patients that have hypertension.
Application in the medicine. Vitamin D and others that exhibit antagonistic activity with respect to the vitamin D receptor invasion also provides methods for antagonizing the vitamin D receptor, methods for treating conditions such as asthma and eczema, and the use of various vitamin D analyses in preparing medicaments for use in antagonizing the vitamin D receptor or treating conditions such as asthma and eczema.
Hello everybody. How important is sunlight for all of us? It is the sun which marks the morning, the beginning to a new day. This very sunlight, apart from giving a bright start, does give humans with something vital: vitamin D. Vitamin D, also known as the sunshine factor, is a very vital nutrient for the human body, as it has multiple roles to play, like absorption of calcium and phosphate, boosting immunity, reducing the risk of cancer and coronary vascular diseases. Calcium and phosphate are very important for bone health. Thus, deficiency of this easily obtainable nutrient has been linked to bone disorders like rickets in children and osteomalacia in adults. We all know that sunlight is received in abundance in our country all through the year. Then why are roughly 61% of Indians are still vitamin D deficient? All that is needed is exposure for a minimum of 15 minutes in early morning sunlight, which can get the mechanism started for synthesis of vitamin D. Alas, our lifestyle habits have shriveled our exposure to this nature's gift. The other alternatives to compensate the deficiency are definitely diet and supplements. To understand where your body stands in the vitamin D deficiency spectrum, it is necessary to get the levels tested today. ThyroCare, world's largest preventive healthcare laboratory, presents a comprehensive vitamin D profile at affordable cost. Trust ThyroCare for all your preventive healthcare needs. Thank you.
Pros and cons. Pros have beneficial effect in reducing cardiovascular risk, insulin sensitivity, as well as systemic inflammation associated with type 2 diabetes. Cons: a high frequency of vitamin D deficiency in large numbers of chronic conditions such as diabetes, cardiovascular, and autoimmune disease, sarcopenia, and cancer.
The sun-safe message over skin cancer could be creating another sort of health problem. Researchers are finding more pregnant women have low levels of vitamin D, which is naturally produced by exposure to sunlight. It's forcing a rethink on taking supplements during pregnancy. More from medical reporter Sophie Scott.
Anna Dungan developed gestational diabetes when she was pregnant with baby Maya.
I exercised regularly, I ate really healthily, so I was surprised that I tested positive.
What she also didn't expect was that she had reduced vitamin D levels.
I don't think you can assume that just because you have a healthy lifestyle that your vitamin D levels will be sufficient during pregnancy.
Vitamin D is produced in skin after exposure to sunlight. A study from the Garvan Institute found nearly half of the pregnant women in a diabetes clinic were vitamin D deficient.
There is an association between vitamin D and diabetes. The worse your vitamin D, the worse your blood sugar levels in pregnancy.
Low vitamin D can lead to a range of health problems, including osteoporosis in both the mother and the baby. And it's our adhering to the sun-safe message that's the likely cause.
I think it's because we're staying out of the sun more. We're very careful not to get sunburnt. We apply sunscreen. We're just careful.
Doctors say it's not only pregnant women with low levels.
We're finding that a surprisingly large number of people are actually vitamin D insufficient or even deficient in vitamin D.
Researchers say all pregnant women should be tested for vitamin D and given supplements if needed. Sophie Scott, ABC News.
Issue applied in Ecuador. Recent years, due to poor exposure to sunlight, low intake dietary vitamin D, little use of supplements, vitamins, and genetic polymorphism, that although the metabolism of this vitamin has been reported, an increase in hypovitaminosis D worldwide, being reflected in the multinational study in which was found that its prevalence exceeds 70%.
Hi everyone, my paper is about hypovitaminosis D and its effects on cognition and depression on the elderly. Vitamin D is vital for several reasons. It helps calcium absorption, it's needed for bone growth, it prevents rickets in children, which is softening and weakening of the bones. It prevents osteomalacia in adults, which is also softening of the bones. It's involved in the immune system and reduces inflammation, and finally protects the brain and nerve cells against cognitive degeneration. How does vitamin D affect depression? The brain has receptors on its cells that vitamin D attached to elicit chemical signals. Some of these receptors are associated with depression or other mental illnesses. It's not clear how vitamin D functions in the brain, but it's believed that it affects monoamines, which are chemicals in the brain. An example of this is serotonin. What is the connection between hypovitaminosis D and cognitive impairment and mental health? Research on this topic is new, so there are many conflicting results. Based on studies and data collected, hypovitaminosis D is common in psychiatric patients, but there was no clear association. Some studies believe that there's an association between hypovitaminosis D and depression, but because almost all elderly patients were deficient, there was no clear link. The mixed results are due to some study limitations. Most study samples were small and less diverse, resulting in outcomes that are not representative of the larger population. Another limitation was the lack of a control group to which results could be compared to. More research must be conducted in a larger setting to establish a clear connection between vitamin D deficiency and mental impairment. So what can we do to prevent this issue? To prevent any complications at a later age, we must pay close attention to our diet and be sure to consume nutrient-dense meals, and to also spend more time engaging in outdoor activities. Thank you for watching.
Conclusion: supplementation with vitamin D during the prenatal period alone did not prevent the development of asthma or recurrent wheezing in offspring throughout the age of 6 years. Prenatal vitamin D levels showed that higher levels were associated with lower airway resistance and better spirometric lung function indexes. Thanks.
And about 25 million people in the U.S. have asthma. That's about 1 in every 12 people.
But now a new study is revealing a way to possibly reduce some of those severe attacks. WOWT's Jordan Shefty joins us now live with those details. Jordan, good morning.
Hey, good morning, you guys. Yeah, this study is trending on Facebook this morning. And for anyone with asthma, preventing attacks of wheezing, coughing, chest tightness, and shortness of breath is a top priority. This new study indicates vitamin D might help. The participants in the study were given either an oral vitamin D supplement or a placebo along with their usual asthma medication. Now, after 4 to 12 months, those who took vitamin D experienced fewer asthma attacks than those who took the placebo. The vitamin D group was also 61% less likely than the placebo group to have a severe asthma attack, leading to an emergency room visit, hospitalization, or both. Now, while the study showed vitamin D offers protection against severe asthma attacks, it had little or no effect on lung function or day-to-day asthma symptoms, but certainly some interesting findings there.
Yeah, especially for people who suffer from those asthma attacks.
Right, it can be such a scary thing, so anything that could potentially shine light and offer a solution is definitely worth looking into.
Vitamin D. All right, 5:48 right now.